Good afternoon. Welcome to another City Club Friday Forum. I'm Doug Marker, president of the City Club. Today's program is Raising Opportunity, where investments in early childhood programs make a difference. Our panelists are Lisa Pellegrino, program director of Portland's Children Investment Fund, Diane Yatchmenoff, a professor at Portland State University, and Margaret Macleod, co-director of Outpatient Services at Morrison Child and Family Services. And our panel will be moderated by Judge Nan Waller. Again, a reminder to please turn off your cell phones and paging devices during this program. And I have a few announcements to go through. Next Friday's forum on February 3rd will be From Hopelessness to Power, the Future of Young Women at Risk. And the panel for that presentation will be Latifah Simon, Director of Reentry for the San Francisco District Attorney's Office, and Joanne Fuller, Director of Multnomah County Department of Community Justice. I'm pleased to announce that on Friday, February 24th, the State of the State returns to City Club. Governor Ted Kulongoski will address citizens across Oregon from the Friday Forum podium. That'll be here at the Governor Hotel. In fact, it'll be in this room. And one of the benefits of being a member of City Club is that you can register in advance for the speech. You can do so by stopping at the registration table on your way out or calling the City Club office at your convenience. We will be requiring prepayment for the event, and we'll open the event for public tickets a week beforehand on February 17th. I'd like to welcome two new members joining us here today, Mike and Tricia Greenfield. Are you here? Can you stand up, please? Thank you, and welcome to City Club. Tonight is January's Final Friday, and we'll be having our usual Final Friday open house from 4:30 to 6 o'clock at City Club Commons at 9th and Washington, just a block from here. It's free and open to the public and a great way to meet other members and the club leadership and staff. Our Citizens Read book group is meeting Monday night at 7 o'clock at City Club Commons to discuss two of James Howard Kunstler's books, The Geography of Nowhere and The Long Emergency. Peter Schoonmaker, president of ILAHI, will moderate the discussion. On Thursday, February 2nd, from noon to 1:30, our Growth Management and Environment Issue Committee will meet at the City Club Commons to discuss the future of bicycling in Portland. Roger Geller, the city's bicycle coordinator, will discuss the upcoming update of the City of Portland's Bicycle Master Plan, and Steve Iwata, the city's transportation planning supervisor, will discuss the Central City Transportation Plan. That committee meeting is free and is always open to the public. We'll be voting on our research report on the Police, Fire, Pension, and Disability Fund on Friday, February 3rd. Until that membership vote, we don't have a position on the report. We'll take a vote then. But to discuss the report, we'll have a special discussion next Wednesday, February 1st at 5:15. Space will be limited, so if you would, please RSVP to the club. So we have a lot of stuff going on. Details on all of these events are available on our website and in the bulletin. Our sponsors this quarter, who make Broadcast of City Club possible, are McHugh & Gisvold LLP and Medico Support Services of the Northwest Incorporated. Would you join me in thanking our sponsors? Thank you. To our program, focusing on the needs of our youngest children is a priority for both the City of Portland and the City Club of Portland. In 2002, Portland voters approved a property tax surcharge of $8.5 million a year for early childhood programs. The goal of the fund is to ensure that children arrive at kindergarten healthy and ready to learn. Here at City Club, we've charged a volunteer research committee to describe the role of child care and education for children in Portland ages 0 to 5. That report, which will soon be completed, follows other City Club research on the needs of child care for working parents and business policies of Portland employers concerning child care. These issues are profound, and certainly as the father of a 3-year-old, I can appreciate them, but they are really emerging as a unique public discussion. I'll introduce our moderator, Judge Nan Waller, who will then introduce the panel members. Judge Waller was appointed to the Multnomah County Circuit Court bench in 2001. She serves on a number of committees and boards related to her interest in children, including Children First for Oregon, the Multnomah County Commission on Children, Families, and Community, the State Welfare Advisory Committee, the Mental Health Subcommittee of the National Council of Family and Juvenile Court Judges. Judge Waller is currently heading up Wrap Around Oregon, a collaborative community effort to address the needs of children with complex mental health needs. Judge Waller.
Good afternoon. Prior to being appointed as a circuit court judge, I served as a pro tem juvenile court referee for 13 years. And so my time in juvenile court has been for about 17 years. I keep track of the children who I have responsibility for. So for some children, I've seen them enter foster care and unfortunately enter adulthood still in foster care. The question that I'm asked most frequently about the work that I do in juvenile court is sometimes, how can you keep on doing this work? It must be so depressing. The stories of lives of families that have come apart, touched by neglect, abuse, substance abuse, mental health issues. And part of the reason I'm here today is part of the reason that I keep going in the work that I do. I am optimistic because we have a vibrant community that is clearly committed to the well-being of all children, especially those most at risk. And so I commend the City Club for having this panel discussion today. I commend the citizens of Portland for having the wisdom in approving the Children's Investment Fund. They understood that investment in evidence-based early childhood programs is money well spent, both from a fiscal standpoint and from a human standpoint, most importantly. The Children's Investment Fund annually invests $3.1 million in 19 early childhood programs, reaching 2,400 children with early intervention, parenting education, and access to immunizations and health screenings. Today's panel will discuss from 3 different perspectives how this investment in early childhood programs is making a difference in the lives of children. And I will say, I'm not a researcher, I'm not an evaluator, but anecdotally, from the thousands of children that I've dealt with, I can firmly say that early investment with the right kinds of support has certainly paid off for many of the children that I have had responsibility for. I'd like to introduce the 3 panelists that we have. Lisa Pellegrino is the program director of the Children's Investment Fund. Prior to taking this position, she was the policy director for the Multnomah Commission on Children, Families, and Community, and I had the honor of working with her in that position. She worked extensively on policy initiatives in early childhood and school-age service arenas. Prior to working at the Commission, Lisa owned a small business in Portland for 5 years and practiced law in San Francisco for 4 years before that. And Lisa's going to speak first, and we'll discuss the history of the Children's Investment Fund and why we know that investing in early childhood works. Speaking after Lisa will be Dr. Diane Yatchmenoff, who is a senior research associate at Portland State University and assistant director of the Regional Research Institute for Human Services, the research arm of the Graduate School for Social Work. Dr. Yatchmenoff has extensive experience in designing and conducting research in the prevention and treatment of child abuse and neglect and in the evaluation of services delivered in public and community-based settings. Diane was the principal investigator for the initial evaluation of the Early Childhood Education and Development Cluster of the Children's Investment Fund and is currently lead evaluator for 2 federally funded projects to improve mental health treatment for young children and their families in Multnomah County. She currently serves as a member of the Multnomah County Child Welfare Advisory Committee and the Multnomah County Early Childhood Council. And she will be discussing the evaluation that was conducted by Portland State to assess the impact of the Children's Investment Fund and its investments on children receiving services through funded programs. She'll then describe what was assessed and the findings from that evaluation. Margaret Macleod is the co-director of the Outpatient Services at Morrison Child and Family Services. Margie has worked in the mental health field for more than 30 years, has a master's degree in social work, and is a licensed clinical social worker. She's worked in the community mental health system in Portland for 26 years, supervising and managing outpatient services. She's established innovative programs for young children, including mobile outreach services for homeless families, a therapeutic preschool, sexual abuse treatment services, and a specialized group programs for infants and toddlers. And she will be our last speaker, and she's really going to bring to life the impact of the investment fund by telling you the stories of some of the children and families that she's helped through the mental health consultation program at the Morrison Center, which has been funded by the Children's Investment Fund. So I read recently in the paper that January 25th is the most depressing day of the year because it follows the holidays, it's grim, it's raining outside, and we all in Portland have certainly been living with that. I suppose the note that I will leave you on is that as I prepared for this, that the January 27th should be a date of optimism for our community, and when you hear the results of the Children's Investment Fund, I think that you will agree with me. Lisa?
Thank you. Excuse me, thank you. Before I begin, I want to just note that we have the first annual report of the Children's Investment Fund available in the back of the room, as well as brochures about the Children's Investment Fund, if you don't get enough information from today's talk. As my esteemed colleagues have introduced, the voters elected to approve the Children's Investment Fund in 2002 and voted specifically to fund 3 program areas: early childhood programs, after-school and mentoring programs, and child abuse prevention and intervention programs. This initiative was modeled on similar successful initiatives in San Francisco and Seattle. The ballot language that was passed by the voters specifically requires that we invest in proven programs and that 95% of the tax dollars that you put into this fund will go to direct services for children. The annual audits of the fund assure that we keep administrative costs to 5% of total revenues. These 2 requirements that I just discussed in the ballot language are really key innovations. The first, because it's imperative that we move research into practice and require that public funds are spent on proven programs that use evidence-based research to support their practices and support their program models. The second, by requiring that we keep our administrative costs to no more than 5%, we give voters a way to keep tabs on us and assure that we are spending all of our money on children, or 95% of our money on children. This makes us directly accountable to the public and assures that we operate with maximum efficiency. Currently, the Children's Investment Fund is investing in 61 programs in 47 different organizations and serving approximately 10,000 children annually. So as I said, while we invest in 3 different program areas, we're here today to talk specifically about our early childhood investments. I'm probably, in fact, I would say I am definitely in danger of preaching to the choir as I look out at this audience and see many of my former colleagues and many of the people that we fund, but nonetheless, I still think it's important to stress why we do this work and why specifically that the ballot language for this initiative was written to require that we invest in early childhood programs. To put it simply, a very significant body of research, of excellent research, demonstrates that investing early pays off for children and pays off for the public. I know that many of you have probably heard of the Perry Preschool study because it's been extensive, or I should say the Perry Preschool program, because it's been extensively studied over the years. This was a program for 3- and 4-year-old low-income children that was delivered in Michigan and also provided, in addition to preschool services, ancillary services for families. An experimental study that compared the results for the children who participated in this program with a control group who did not participate in the program found many positive outcomes for children who participated, including higher graduation rates, lower rates of grade retention, lower rates of placement in special education, higher employment rates, lower use of welfare assistance, and fewer arrests. Those are exactly the kinds of outcomes that we want to see for our children and for the public. Researchers have gone on to analyze the results, or to further analyze the results of this study, to try to value the benefits to the public of investing in preschool programs such as this. The HighScope Foundation found that for every dollar that was invested in the Perry preschool program, the public reaped $13 or saved for $13 in future expenses for things like special education, criminal justice system, and welfare assistance. In 2003, two economists from the Federal Reserve in Minneapolis did a further analysis on the Perry preschool program to try to quantify the internal rate of return, which is a term that if there's any business people in the audience will certainly recognize, of investing in this preschool program. They concluded that the real rate of return was about 12%, and characterized their estimates as conservative because they didn't take into account the benefits to siblings of the people who participated, as well as the parents and potentially to future generations. Also in 2003, the Washington State Institute for Public Policy conducted a study for the Washington legislature on the benefits of prevention programs for youth. And this study looked at a lot of prevention programs, but in the early childhood arena, they found that two specific early childhood interventions had significant cost saving for the public. The first of these were home visiting programs that were targeted at low-income women who were either pregnant or parenting. And the second was preschool programs for low-income 3- and 4-year-olds. Taken together, these two interventions provide lifetime benefits that the study valued at between $16,000 and $27,000 per child. And these benefits were over and above the cost of the program. The benefits that they valued included things like completing education, avoiding drugs and alcohol, avoiding child abuse and neglect, avoiding teen pregnancy, and public assistance costs. Research also tells us that children who start behind often stay behind. The children who don't know their alphabet when they enter kindergarten score under the national average in reading by the end of the first grade. Nationally, 88% of the children who were poor readers in first grade are still poor readers in the fourth grade. And finally, 74% of readers in the third grade are still poor readers in the ninth grade. The Children's Investment Fund has invested in exactly the kinds of programs that research shows will help children avoid these kinds of outcomes and save tax dollars down the line. As, again, Nan has so generously presented, I'll say again, we invest about $3.6 million annually in 19 programs that serve about 2,900 children a year. All the funding decisions that we make are made by a 5-person allocation committee that is headed and chaired by Dan Saltzman, who was the person who spearheaded the campaign for the Children's Initiative in 2002. Our funds are invested in programs that use evidence-based models or that employ research-based practices that show achievement of positive results for children. Moreover, we focus our investments on the neediest children in our community. Approximately, or more than 50% of the children that we serve in our programs are in families that earn below the federal poverty level, which I will remind you is only $19,000 a year for a family of 4. Approximately 30% of the children that we serve live in families that speak a language other than English in the home. So I'm going to try to also just paint a big picture of kind of the types of programs that we're funding here and kind of where the bulk of our funds are going. Over 2/3 of our funds have invested in early Head Start programs, Head Start programs, and home visiting programs that focus on child development, parent education, and referral of families to other needed resources. As I just discussed, these are the highest impact investments that we can make. There's been, the studies I've quoted to you, as well as a reams of research that I will not bore you with the details of, that say that these two investments in particular are they pay off incredibly both for the kids and for society. We've invested approximately $750,000 in childcare programs that increase the availability of childcare, improve the quality of childcare, and provide additional services for childcare providers. Margie's going to tell you a little bit more about one of those in particular. Research, again, has consistently shown that quality childcare supports children's achievement of the developmental milestones that are key for the child to show up in kindergarten ready to learn, and thus for their foundation for their future educational success. Of the total $3.6 million that we're investing annually in early childhood programs, approximately $1 million of those dollars go into culturally specific programs and organizations, or programs that serve especially needy populations, such as children with special needs, or children who are infected or affected by HIV/AIDS. Research tells us that we will be most successful in reaching different cultural groups if we invest in culturally specific programs and organizations. Finally, the Children's Investment Fund recently entered into a partnership with the Meyer Memorial Trust to support a community-wide literacy strategy. The partnership as a whole will focus on funding literacy programs across the age spectrum and programs that are specifically targeted at families. Our funds in particular are going to go to expand the Raising a Reader program, which is a national model program that has shown results in getting parents to read more frequently with their children. All of the programs we've invested in are designed to promote child development and help children arrive in kindergarten ready to learn. In order to help us understand how the children who were served by our programs were developing and whether or not they were meeting these milestones that are key to being ready for kindergarten, we retained Portland State University to study 13 of our early childhood education programs. I'm going to hand it over to Diane and let her give you the details of that study in terms of what the methods were and what the results were. Thank you again for your time, and please do pick up some materials if you'd like to know more.
Thanks, Lisa. Good afternoon. It's really nice to see so many familiar and friendly faces out there, especially for those of us that are not used to speaking in such august circumstances. We're more used to the classroom. At Portland State, we were asked to develop and pilot an evaluation of 13 programs that received grants in the very first round of funding. These 13 programs were grouped into what we called the Early Childhood Education and Development Cluster because they shared similar goals aimed specifically at school readiness and the provision of high-quality childcare. 12 of the programs directly served children and their families, and it's those 12 programs that I'm going to draw from when I talk about findings from this study. The 13th program actually provided supports, education, training, consultation, and resources to the provider network, and we handled that program differently or separately in the evaluation. Just by way of background, the child-serving programs in this cluster were selected for funding because they met the criteria for evidence-based or best practices. They were serving children who may be at risk for developmental delays because of a variety of social, contextual, or family factors. They were delivering educational curricula aimed directly at children's developmental needs. They were also providing critical additional supports and services to families, such as the home visiting that Lisa mentioned, that we believe to be linked with positive outcomes, and they met national standards for high-quality childcare. We created a framework for the evaluation with the help of an advisory group and also the providers themselves that connected the specific services and activities of the programs with the four key dimensions of school readiness that come from national standards and the literature. And you all know what those are. A child who is safe, healthy, fed, developmentally on track so that he or she is ready to learn when they get to school. A family or caregivers that are able to parent effectively and to foster learning in the home. Services and other supports available in the community as needed for the families. And schools that are ready to help children prosper in the transition to K-12 education. Now that's a big map of school readiness, and given the specific mandates of the Children's Investment Fund and the limited resources for evaluation, we focused on two very specific aspects of our framework. The first was service delivery. We wanted to be sure that the programs were in fact serving the intended population and implementing the core components of best practices, an accountability piece. The second was the children themselves. We wanted to know how programs were assessing developmental status of children. We wanted to know how those children looked when they entered the programs, and we wanted to know how they fared over time in the programs. We were also interested in when there were concerns about children's progress, how the programs responded, and what sorts of services were in place to address those concerns. So we asked the programs to provide us a considerable amount of data for an implementation study and a child tracking study. And there isn't time to talk about really the methods and the measures and data collection procedures and that sort of thing, but I do want to pause and acknowledge the extraordinary degree to which the providers stepped up to the plate to work with us, not only to help us develop common data collection protocols that they all agreed to use, but to assess and report on the status of children at multiple points in time, which was new for many of the programs and represented a substantial effort for which there were, in most cases, not additional resources. I'm going to talk briefly about some of the findings from the evaluation, and if you're interested, I have a handout that actually has some additional stuff from what I'm going to say, and the executive summaries, I think, are in the back of the room. And of course, the final report is available if you're interested in more detail. But before I do, I need to put a cautionary note, as I always do, about limitations in any study like this where we're aggregating data reported to us by programs. And despite as much as we might, all of us have aimed for consistency and accuracy and in terms of how we define and count things, the data really need to be thought of as a rough estimate. But in fact, it may be the first time that we've had an estimate about early childhood programs in our community as a group and how they're doing and how the children in them are doing. So with respect to implementation and accountability, in this particular cluster of 12 programs now, because I'm talking about the direct service ones, investment fund dollars provided services directly to children, to more than 1,000 children in the 18-month period in which we collected data. Most of these children were low income. In this particular group, 75% of the children were living at or below the federal poverty level. They were also a strikingly diverse population. 40% of these children spoke a language other than English in their home, and 50% were either Hispanic, Latino, or African American. As promised, programs in the cluster indeed utilize standardized developmental curricula, such as Parents as Teachers or Creative Curriculum, and often within program models like Head Start that are nationally recognized as best practice. We did not have the resource in the evaluation to conduct an external audit of fidelity to these models, but we did review the procedures that programs had in place for quality control and to report to their accrediting entities, and all of the programs had something in place for this purpose. Programs also delivered a wide array of additional services beyond the educational curricula, and thinking back to that Ready Child and Ready Family, these services included more than 2,500 screenings for things like vision, hearing, dental, well-child health care, immunization status, as well as developmental status. They provided nutrition counseling as well as meals to hungry youngsters, parent education and support in groups and during home visits. More than 3,500 home visits were delivered in a one-year period to children and families in this cluster, as well as a wide range of referrals for medical care, nursing, recreation services, early intervention, and other things in the community. One of the challenges we noted, and it was echoed by programs, is attrition. 467 children exited the programs during the data collection period. Many, of course, went on to the next age-appropriate setting, like kindergarten, but others did not. Others disappeared. Providers expressed concerns about their ability to conduct enough of the kind of outreach to these families, many of whom are highly mobile, move frequently because of employment, and have other challenges as well. And in this era of shrinking resources for public services, providers expressed to us their concern about their ability to provide the comprehensive services as well as the outreach to help stabilize these families. All in all, however, the summary statement would be that the implementation in this cluster was quite solid. For the child tracking study, programs provided us with data on the developmental status of 700 children. For more than half of these, data came to us at the time of enrollment and again 6 months later. And happily, most children were doing well. 80% of children at both screening times were on track in all developmental areas. That is language communication skills, fine and gross motor skills, problem solving, which is essentially pre-math, and social emotional development. When screening suggested, which is about 17 to 20% of the children, that there might be a risk for developmental delay, most often it was in the area of language, communication skills, and boys were lots more likely than girls to be of concern. But it's also promising to note that the large majority of children for whom there were initial concerns either no longer showed potential delay 6 months later or maintained their status. And that maintaining the status is very important when you think about the sizable number of children in the sample with diagnosed disability, where it may not be realistic to expect them to catch up, but we don't like to see them decline further. However, concerns emerged or increased for about 14% of the children in the sample, again, often in the area of communication skills. And there may be a couple of different reasons. Providers indicated that in part they had more opportunity to observe children over time. They got to know the parents, they learned more from the parents, they became more aware where there might be potential difficulties. However, it's also possible that as children aged a little bit and new developmental milestones are expected, the concerns or problems, potential problems are revealed at that stage. A 9-month-old who doesn't have any words probably flies through the developmental screen, and it might not be the same at 15 months if that same child is still not talking. We and the providers all felt that these findings pointed to the importance of being able to systematically monitor children over time. But the resources and manpower to do that presents a serious challenge and barrier, and it's been one of the real strengths of the investment fund that has supported and encouraged and wrestled providers into providing us those data. We also looked at the response in terms of referrals and services initiated when there were concerns, and there's lots of information in the report about the nature and the extent of referrals that were made. I want to be sure to note that the investment fund grants not only allowed programs to serve children who otherwise would remain on their waiting lists because of capacity issues, but even more important, to maintain continuity of services for children who lost OHP eligibility or moved in and out of OHP eligibility. This was cited repeatedly by programs as a tremendous benefit of the initiative. We have a serious problem in this state for serving children who are not Medicaid eligible, and to have dollars that are not tied to that particular funding stream has been a tremendous benefit to young children in our community. We completed this initial study last summer and reported out on it in the fall. And this year, at the request of the investment fund staff, we've shifted our focus to another important objective, which was to increase the capacity for evaluation among the early childhood programs. So we've expanded our scope actually to include all of the grantees, and we're now providing technical assistance to help programs identify for themselves the appropriate outcomes, to look at how they're going to measure them, to make sure they have procedures in place for gathering the data and reporting it to the investment fund. Some of the programs, of course, like Morrison Center, are highly sophisticated and don't need our help. Others less so. And so we're doing some assessment of capacity at the program level and the needs for further training and technical assistance that the investment fund might be able to provide so that we can really reap the benefits over time sustainably for this important initiative. So I'm going to stop and pass it on to Margie.
Hello, everyone. I have the very delightful task this afternoon of telling you about the children and families which Morrison's Early Childhood Consultation Program has served. This Morrison program, funded by the Portland Children's Investment Fund, takes early childhood services into child care centers and to family home providers. We are working with 9 child care centers located throughout the Portland area and about 50 family home providers. These are individuals who are providing child care in their homes as a business. In order to assure that the highest risk children are able to receive the services of the program, we carefully selected child care center sites and providers that were located in low-income neighborhoods and communities for participation in the program. We've hired master's-level mental health professionals to provide 2 core program services. That is, consultation with child care providers and workers and center directors, and providing evidence-based prevention groups in the child care centers themselves. The purpose of the program is to promote the social and emotional development of young children by fostering safe, secure, stable relationships amongst parents, children, and child care providers. It is now well documented in the mental health field that secure relationships with adults leads to emotional health in young children, and that emotional health is one of the key foundations for school readiness. We are also interested in building a child's capacity for initiative, self-control, and attachment to others, and in building the capacities of parents and child care workers and preschool teachers to relate effectively to children and to understand their behaviors. Reducing the stress of parents and teachers, identifying young children with early problems as soon as possible, and increasing access to needed mental health services are also goals that we've had. I have 3 stories to tell you this afternoon about the families that we've served, about the role of early childhood mental health consultants, what they do every day, and how our services actually work. Kate, a Morrison preschool consultant, reports every morning to a large child care center serving about 80 toddler and preschool children. At this center, some months ago, she met a family that included a grandmother, her 24-year-old daughter, and 2 5-year-old boys. Both women were single parents and mothers of 5-year-old sons, and the boys were about 8 months apart. The older boy, the grandmother's son, was very challenging and disruptive within his preschool classroom when we got there. He was hitting, punching, and kicking other children daily, yelling often and loudly, tantruming, demanding to be first at everything, first in line, first to be called upon. He became quite disruptive when the staff and his teacher did not concede to his demands and was frequently being sent home for unmanageable behaviors. All the behaviors that I just described are the kinds of behaviors that do get children expelled from childcare throughout the United States, and I think that's actually a growing local and national concern. But the center director at this child care center was different. She believed that young children shouldn't be excluded permanently from child care and wanted her staff to go out of their way to help this young boy, even when sometimes the staff felt that keeping the child in their classroom just only made their jobs more difficult. The younger of the 2 boys, there were 2 5-year-olds, also had problems with tantruming, and in his childcare classroom, he was often more quiet and withdrawn and refusing to participate in activities in the classroom. He spent a long day in childcare while his mother worked, trying to earn a living for he and the family. Both boys were supposed to enter kindergarten the next year, and their mothers and their teachers were really worried about their behaviors and about how they would do in school the following year. Within this center, Kate, the Morrison consultant, provides evening Incredible Years parent groups and stress management groups for parents. All parents who are involved in the center can come and register and take the groups. Kate also supports and consults with child care staff, the center director, and works in preschool classrooms during the day. She organizes communication and problem-solving activities for the kids in the classroom, designing interventions to help kids learn social skills and how to handle their feelings and emotions. Many of the interventions that we use in the classroom are drawn from the Incredible Years Dinosaur School program. The Incredible Years groups that I have been referring to were developed and thoroughly researched by Dr. Carolyn Webster Stratton at the University of Washington in Seattle. She her research is really impeccable, and her research has met the gold standard for social science research in our field. And these programs that we're implementing have found to be highly effective in preventing mental health disorders in children and teens. At Morrison, I think that we've been really fortunate too by having Dr. Webster Stratton's direct involvement in helping us implement the services. Now back to this grandmother. The grandmother, her next step was that she enrolled her daughter and herself in an Incredible Years parent group, and they came. The daughter nearly dropped out of the group after the first few evenings because every time she tried to talk about her situation, she began to cry and, cry quite hard. But she decided to finish the group and decided to go on and take the next stress management group. As we became acquainted with this mother, it was really clear that she was showing early signs of depression and that without help and intervention, she was on her way to having more ongoing and serious problems with depression. Simultaneously, the grandmother and the preschool teacher and Kate all got together to try to figure out how they were going to help this child who was having so many problems in the classroom. So all the adults pooled their information that they had about the child, about his behavior, about how to implement some of the parenting tools that the grandmother was learning, and about how to find some strategies for the teacher to use in the classroom. The consultant encouraged the grandmother and the teacher to try new things, to be consistent. She provided support and encouragement, and she got the three of them back together when things weren't going very well. Kate also brought Tiny Turtle to the classroom. Tiny is a puppet from the Dinosaur School, and who is scared by loud noises, always goes about doing things very slowly and deliberately. When frightened, retreats into his shell. Our consultant used this puppet to engage the child in imaginative play and to help the boy learn Tiny's secrets. And these secrets were to go slow, to stay calm, to retreat into a safe place when things got too hectic, to take a deep breath, to relax, to say to himself, I can do it, I can calm down. The vulnerability of the puppet and the small animal really appealed to this child. He got involved in the play, and his social and emotional learning was underway. Tiny's secrets also helped the classroom teacher. Similarly, the second child also benefited from more positive attention at home and at school and began speaking up and participating more in class. Now, 18 months later, the boys are in kindergarten, they're succeeding with only minimal behavioral challenges, and that's a huge part of our success. As I look back on this family and our experiences with them, I think that the grandmother's courage to ask for help, she initiated a lot of the responding to our groups and asking for help within the center. The child care center's willingness to stand behind a boy who was struggling, and the early childhood mental health consultant who had a whole package of comprehensive services that she could pick and choose from and use strategically over time to respond to the family's needs were our ingredients for success. And I think that the story illustrates the usefulness of the evidence-based practices, on-site services designed specifically for a boy and his family, support across 2 generations, and developing strategies for teachers to use in their preschool rooms. Maria, another one of our consultants, spends 2 mornings a week at another small child care center. Maria received a referral from the center director one morning about a 4-year-old little girl who was beginning to act out in child care. In consultation with the mother, Maria discovered that the little girl started having difficulties just after her parents separated. This little girl was angry at her mom, yelling, not listening, not complying with her usual routines, and she just really wasn't the good-natured child that she'd been before. In this one-time consultation, Maria suggested that the mother read several children's books to her daughter, books that described feelings, that described being angry, and encouraged the parent to talk to her little girl or to do art activities with her little girl about her feelings. In a telephone contact about a month or so later, the mother reported that things were that things were much better at home, and said, "My daughter asked me to read that book over and over and over again." So for this family, a very brief consultation on the spot at the child care center made a really big difference in their lives. A final example comes from Shannon, another member of our early childhood consultation team. Through her work with a network of family home providers, Shannon met and consulted with an in-home provider whose 4-year-old son was jeopardizing her business. This provider was contemplating closing her business in order to take care of her son herself. Her little boy had almost no impulse control, hit, kicked, and bit everyone around him, including his mom, disregarded other children completely, threw toys at them and then laughed, and had severe speech and language delays. With the consultant's ability to go to the home, to listen to what the provider said about her son and her situation, to observe and assess the boy's behavior, and with the provider's knowledge of the resource system, particularly special education services and mental health services, the provider was able to find an early intervention program for her son. The boy is now eligible for early childhood special education services and has speech therapy, and the provider has a thriving child care business that with her son's involvement in a full-day program outside of the home, she was able to keep her business, and it is now doing very well. I hope that the stories from our program have brought to life the needs of young children and the power of early childhood services.
Thank you. Thank you. Well, it's now time for questions. We have one microphone on the floor over here to my left. Our first question will be from our board host, Gwen Milius. Gwen is a member of the Board of Governors and our new Leaders Council liaison, and is a partner with SRM Architecture and Marketing. Gwen?
I have a 3-part question for our panel. Actually, maybe it's just 3 questions. And I realize I might be one of only a few people in the room that don't know the answer to these questions, but we have a radio audience to consider, so I'll go ahead and ask them. I was wondering if there's a distinction between the term daycare center and early childhood education program, and if you guys could define what makes an early childhood education program. I've heard them used interchangeably, and I'm not sure that's accurate. I also wanted to know what the prerogative of a child in early childhood education is and what their academic profile would look like when they got out, what makes them really ready to learn, and if you can give concrete examples. I know being able to recite the alphabet was perhaps one of them. And I wanted to know how well we're meeting the demands for this sort of program citywide, what kind of waiting lists we're looking at, and how much a family's earning potential affects their ability to get into these programs.
All right, why don't you answer the first one?
All right. I guess this is good.
Or you can do it from here.
Oh. All right.
You whatever, you should know you can sit.
I guess this is going to be a team effort, so it's better to sit here and work with my team. I guess I was going to take a first crack at the question about daycare and early childhood education programs, and I think that daycare refers, most commonly to, generally women providing childcare in their homes with a small group of children. It's kind of what we consider as daycare. So it's more kind of the care and supervision of children, whereas an early childhood care and education program would be a day of program activities in which children are involved in developmentally enriching activities and kind of academic activities to learn and grow.
And if I could add to that, I would say that, you can also, there are places that are called child development centers, for instance, that provide childcare, say for working parents on a full-day basis, but as part of their program, what makes them a high-quality program is that they provide activities that are meant to help develop children, as opposed to here's a room and here are a few toys and hang out and you can turn on the TV if you want to. That would be the kind of two extremes that I might. It's not that the early care and education programs are not providing childcare, because they are, but they're doing it in an environment that is meant to stimulate development, as opposed to one that doesn't particularly take that into account.
And there are standards about, early childhood care and education program that the National Association for the Education of Young Children promulgate, and many centers respond to those standards, and the standards are, cover a full range of things, from the physical environment to the qualifications of the staff to the kind of activities that the kids are involved in through the day.
Staff-child ratios as well.
Yes.
Chris Allman, a City Club member. I'm a new commissioner for the Washington County Commission on Children and Families, and I have to say I'm very jealous that the City of Portland has supported programs such as this. But it makes me wonder, because funding is woefully inadequate for preventive services for children and families. Salem just doesn't get it. And I wonder, rather than thinking of local solutions to fund this, whether another strategy might be to work at the level of Salem to really get the funding that goes to the commissions to ramp up, so we can support these programs throughout the state and increase the level of what we need to do for all kids in the state.
Well, I would certainly agree with you, and I think that there are, I've been actually working with 3 child advocacy organizations that are statewide: Stand for Children, the Children's Institute, and Children First for Oregon, that are all aimed at doing exactly that in sort of various aspects of working for more state funding for key children's programs. It's definitely something that needs to happen, and I'm try to remain hopeful that it will.
Hi, excuse me, Chris Wu, City Club member. Thanks for all of your hard work that you do with our kids. I'm a single 30-year-old guy, no kids. I can think of at least a half dozen other people who fit that description. Remind me again why people like me and in my demographic should actually be motivated about this issue. Why is it that's something that we should care about? why is it something that we should go out and work for?
Well, I can think of a number of reasons. For me, I would say if you just want to even look at a sheer monetary perspective, what's going to save me money in the future? A purely selfish perspective, which I'm not saying that would necessarily be your perspective, but that's one way to look at it. That is a compelling rationale to invest in these types of programs and invest in young children, because it's much easier to affect what happens to a child when they're young, and there's some very key interventions that are worth supporting to do that. It's a focused investment, and it's one that shows clear financial benefit to the community as time goes on. And to the extent that everyone all over the country is realizing this is an element that if localities decide to invest in, it begins to affect the population even as they move around. The second is, really more from the heart. The young children, you can show such clear benefit to them at this age. The outcomes are so strong that that to me is compelling reason to try to intervene as early as possible. We're gonna do the best for the child if we do that. So those are the two top on my list. If those are not compelling, tell me, and I'll see what else I can come up with.
Can I add something? I want to add that also, just on a personal note, the well-being of our children is a measure of the health and the fabric of our community.
Good afternoon. My name's Virginia Davis, and at 9 o'clock Monday morning, I will officially begin with ballot measure 111. And that is the Healthy Oregon Plan. I have a few flyers. Dr. Evan Celino and Dominga Nunez of Virginia Garcia Clinic are the chief petitioners. I suggest you start by donating whatever appeals to you in multiples of 111. Then it's under the radar still, but we will be, I'm sorry, I beg your pardon. I would like to first thank the Oregon voters for their wisdom in establishing the Children's Trust Fund. Then I'd like to thank all of you for an excellent report who are here today and the people who worked on it. I'd like to state briefly that I had excellent childhood education from my Aunt Leslie and Carmel, who taught in Del Monte Elementary School, and she'd have all the mothers come in. When Jose didn't have shoes, she'd say, "We're going to go see Doris Manning after school." I beg your pardon. My question is, can this state start out with infrastructure, with
Hi, I'm Kathy Kaufman. I'm a City Club member, and I work for Children First for Oregon. And I would just like to ask if you could speak more to why it's important to shift the evaluation to building the internal evaluation capacity of the grantees, why that matters both for the programs and for the kids who are participating in them.
Well, I think you should speak to why I can say some stuff about it.
We felt that, in general, this is an endemic issue among programs. The programs in our portfolio, they struggle to find human resources and financial resources to assess the effects of what they're doing and the effects on children. And it's costly. It's not. If you don't have any expertise in it, it's difficult to do. And we felt that we would make the best sort of long-term impact, even if our dollars don't go on into the future forever, that we would make a longer-term impact if we began to try to train people to think about it for themselves and to work at being able to collect this data in their organization without necessarily depending on an excellent research institution like PSU to do that for them. So that, that was our goal, and we'll see if we get to that goal over the course of the next year and a half. So far, I'm really pleased with the progress that the team is making in going out and assessing what's happening with organizations, and assessing their capacity to do this work, and to help them be able to report to us on the outcomes that we're looking to hear about. So I think it's really the next step that we need to take in the community to try to really increase capacity to do this type of work so that we can come before groups like this and report results to you.
I would actually second that. With the pressure in the state and actually nationally around accountability and evidence-based practice, it's really a good thing for organizations to move forward, to be able to self-evaluate. External evaluation is great, consultation around evaluation is great, but it is not always possible to bring the resources from outside to do evaluation. And so I actually think it's a good move and a move towards sustainability.
Kurt Wabring, member. I'm impressed with the way you are using research and best practices to design and do your programs, and that you're carefully evaluating even in the first year. In the Head Start program, one of the impressive things about that was they were able to track students as they went into grade school and the graduation levels, and it was that proof which was so impressive. My question then to you is, are you thinking now about tracking this apparently very mobile population into the future? I'm not talking 3-4 years, but 5, 10, 15 years.
Yeah, we would love to be able to do that. Our current authorization for funding goes through the middle of 2008. So that's one limitation that's upon us as I speak to you right now. I think to conduct an experimental evaluation, which is really what you're talking about, an experimental evaluation that looks at the people who participated in the program as compared to a certain control group, does need to be, if you want to look at something like graduation rates, you're going to need to, and you're going to start in early childhood, you need to be thinking, you've got a good 15 years, you're going to need to follow children. We haven't taken that on at the moment because of its expense. It's a very expensive thing to do because there's such attrition of population over time. People move around so much in America. And also just, you have to have a major research institution usually to design your study and to conduct it. I think it would be an excellent thing for this community to do, and I would love to be able to afford it. So we'll have to think about that perhaps for the future.
We did have a fair amount of conversation in the evaluation advisory group and the evaluation team about the feasibility of tracking the particular children in our study who were entering kindergarten to find out how they looked with respect to actual school readiness when they got there. And again, it was a feasibility and resource issue, and it would have only been the subset of children that reached that point. So it's unfortunately costly to do that kind of follow-up.
Judge Waller, thank you for moderating. Diane, Lisa, Margaret, thank you so much for participating with us today, and we're adjourned.